Let's welcome Dr. Siva, an expert on peripheral vascular disease in the Tampa Bay area, who is going to educate us on this topic. Welcome, Dr. Siva.
Thank you.
Doctor, what is peripheral vascular disease?
Peripheral vascular disease, also commonly known as PVD or PAD, means blockage in the arteries that carry blood from the heart to the legs.
What causes PVD?
It is caused by buildup of fatty plaque in the arteries of the leg called atherosclerosis.
How common is PVD?
8.5 million people in the United States have PVD. 12 to 20% of people over 60 have PVD, and actually only 25% of them are aware they have PVD.
Who can get peripheral vascular disease?
There are a number of risk factors for peripheral vascular disease. Smokers are at a 2 to 6-fold risk of developing peripheral vascular disease. Other common risk factors are age over 60, diabetes, high blood pressure, and high cholesterol.
Doctor, how do I know if I have peripheral vascular disease?
The classic symptoms of peripheral vascular disease, Jeannie, is pain in the legs on walk-in, relieved when resting. Now, the pain can occur in the hips, buttocks area, thighs, or calves. Actually, 40% of patients don't have any pain at all. Some of the other symptoms of peripheral vascular disease are smooth, shiny skin, loss of hair in the legs, muscle wasting, cold to touch toes, numbness in the feet or toes, and sores or non-healing ulcers in the legs.
How do you diagnose peripheral vascular disease?
PVD can be diagnosed by a simple non-invasive test called ankle brachial index, which measures pressure in the ankles compared to the pressure in the arms on exertion and at rest. There are other non-invasive tests like ultrasound, MRA, and CT, which can diagnose PVD.
Doctor, if I have peripheral vascular disease, how can you help me?
Well, first of all, if you're a smoker, you can help yourself in a big way by stopping smoking. Supervised exercise programs can also increase the walking distance. Now, I start my patients on aspirin to thin their blood because patients with peripheral vascular disease have a higher risk of a heart attack or a stroke. If they have diabetes or high blood pressure, that needs to be better controlled.
Can all patients be treated in this manner?
No. Frequently, patients need a procedure called angiogram to look at the arteries of the legs in detail. Now, this is an invasive test requiring dye and takes about 2 hours. If a blockage is found during this procedure, this can often be opened up with a stent. Unfortunately, some patients may need a bypass surgery to their legs.
Now let's move on to some actual patients who will talk about their peripheral vascular disease and their angiograms.
I had pain in my legs. My doctor seemed to ignore it. Then I met Dr. Siva. He told me I had blockages in my legs. He fixed those blockages with stents. I have no more pain in my legs.
I had severe leg pain. I could hardly walk. Dr. Siva ordered an ultrasound. They found 90% blockage in my leg. He corrected that, and now I can walk freely now.
I could not walk more than 500 feet without having pain. I saw Dr. Siva, and he ordered the correct tests and found that I had blockage in my legs. Dr. Siva did a procedure and fixed my legs, and now I can walk long distance.
I previously had stents in my legs. Still had a lot of cramping. A friend recommended that I see Dr. Siva. Dr. Siva done an angiogram, found a buildup of plaque. He removed the plaque, and now I have no more cramps. I'm very happy. Thanks, Dr. Siva.
I was diagnosed with vascular disease with severe blockage in my leg arteries. A doctor told me that the blockage had been there for a long time and would be difficult to fix. I got a second opinion with Dr. Siva. He did an angiogram and put in a stent and fixed my blockage.
I had a non-healing ulcer in my leg that was infected. I could have lost my leg. I was referred to Dr. Siva. He fixed the blockage in my leg and my ulcer is healed.
If you have pain or stents in your legs, you need to see Dr. Siva. I can now walk without pain in my legs. He really has changed my life.
If you have PVD, you need to see Dr. Siva.
So there we have it. If you have peripheral artery disease or concerns about leg symptoms, please call the number on your screen to make an appointment.